Hello, it's Dr. Joseph Aiello from San Diego Center for Integrative Family Medicine, and today we're going to do an interview with a neighbor of mine, Kirk Texiera, and I'm very interested to hear what he has to say. I've noticed, and he's noticed, that over the past many years that chronic diseases have become a big issue with the population of America, and Kirk does some things with people being physically active and trying to promote that with them, and well, I'll let him tell us what he does, but I want to get some ideas from him on where the health of people are going and how to reverse that and what he's seen. So right now I'll introduce Kirk. And so tell us, what exactly is it that you specialize in, or how do you?
Well, first of all, I'm the owner of Workout with Kirk right down the street in La Mesa. I specialize in physical fitness training, functional movement patterning. I've got tremendous education behind me. We've literally gotten people off of insulin. The physicians have removed insulin. Yes.
Okay.
Yes, which is exciting when you're in your 80s. We've gotten a few folks out of wheelchairs. So almost an extension after physical therapy, we step in.
Okay. Okay, so you have a site just down the road, which is like a gym?
It's a 2,100 square facility. It is a gym. It's a fitness center, rehabilitation.
Fitness center, okay. But you also go out to people's homes?
We also go to people's homes too.
Okay.
In retirement villages. We like to have people come to us, but obviously some of my folks are severely disabled and they can't drive, so I have to go to them.
And do your referrals come from people that have had success with people, or are you referred from other medical?
From chronic pain physicians,
okay.
interventional anesthesiology. I'm referred from a few doctors. A lot of it's just word of mouth. You know, you help my neighbor.
Right,
I tell my neighbor, well, my mom's doing great, or however it goes.
Go see Kirk, because he's going to help get you.
Because the big thing for me, actually, I fell about 8 years ago, and it was really bad. And I know how to fall.
Right.
I've got a black belt. I'm a trained martial artist, and I hit my hip, and it's turned into severe arthritis. My hip's basically blown and bone.
Okay, and from there you started figuring out, how can I deal with this pain and movement?
And try and move, and then of course I have a lot of empathy, having a few other things with people who are older, because I know what it's like when you have a few little issues. I don't want to call them disabilities, and it's hard. You know, it's hard sometimes when you have, say, chronic pain for years, and you want to exercise, and it hurts.
Okay. You know? So when you evaluate somebody, what's kind of some of the common things or the themes that are running through their issues, their disabilities? What are you kind of seeing? Are there some things that you're seeing that are
type 2 diabetes
consistent,
running rampant?
And overweight probably with that?
Yes, there's an overweight. I've got one gentleman, he's 270 pounds at 70 years of age.
Oh.
Tough.
Yeah.
Tough. He's working very hard, but you know, it just gets... I'm also an obesity survivor. I eat my way up to 325 pounds.
Oh my.
It took me 3 years to lose 105 pounds.
Wow.
Just with physical fitness. The eating wasn't the best, but I just did so much physical activity, I literally burned the fat off my body.
So you have a lot of empathy for people that are in this.
Absolutely.
Overweight, lack of movement, chronic pain, and try to figure out how can you get in with them and figure out how to get them moving along on this spectrum of getting better.
How can we help facilitate? One of my big things is I believe that healthcare and fitness training, the fitness profession has to be more together, rolling together in the same direction, because it just doesn't seem to be happening.
No, I agree. I mean, we have a saying, it's the way you eat, think, and move determines your health.
Yes.
And if you don't eat, think, and move in a way that's healthy, then you're going to degenerate. And that's probably what you've seen with people. Though unfortunately, you're there at when, hey, fix me, when I'd rather be on the end like, oh, you're starting to have a problem, let's prevent this from getting worse, right?
Exactly.
Yeah. So what kind of things would you, for people, be more physically active, or as far as...
The first thing I like to do is get an evaluation of where they are physically.
Okay.
Is it safe for them to work out? Right? The safety first, right? Are they a candidate to start?
Okay.
You know, sometimes the doctor, all right, exercise is tolerated. Great. Well,
what's the tolerance?
Right. The patient might think that 4 minutes on the bike for the day is enough. Well, it might not be enough.
Right. And
it's a lot of times, we do different tests. Like we'll have people maybe on a bike and they'll do a talk test. I'll do a talk test to make sure they're not, overdoing it.
Oh, okay.
Because sometimes obviously if they can't say the Pledge of Allegiance, they're probably going too fast. Because the whole thing is we want to start off slowly and progressively. And make it kind of a fun experience. This is what I do literally every day. So I like to have some fun.
Okay.
And then how do we motivate them, and more importantly, how do we maintain the results that we achieve? How did I keep off? How do I keep off the 105 pounds?
Right. I know people put a lot of effort, a lot of money into this.
Yes.
And they want to continue to be successful, and that's you. So you show them where they're at, how to get where they're going, and then how to continue with what they're doing.
And we even take videos and show people how they move. Oh, right there.
Oh.
Live. We can actually take their video right there and show them on the screen, how are you moving? Because a lot of people, maybe they have a shoulder down.
And they would never know.
They don't know. But maybe they have chronic low back pain.
Right.
Right? Maybe they have a knee issue.
Yeah.
And it just seems people are really disconnected from their bodies.
That's got to be very demonstrative for them to see that.
Oh, yeah. But at the same time, empowering them.
Right.
And now they, okay, great, I can work on this.
Right.
I can give you tools to do away from me.
Yeah.
Because if a client sees me, say, 50 minutes 3 times a week, that's a 168-hour week. I've barely seen them, statistically speaking.
Right.
So they need to be doing a few things at home.
Okay.
As long as they're safe, they feel safe, they can do a
Right.
couple of things. You know, just being able, as we get older, in 80s, 90s, to stand up out of a chair safely.
Oh, yeah. Lisa Marie talked to me about that.
You know, to go to the
Yes.
restroom. You know, there's a national
Yeah.
test, the tug test, timed up and go, where you get up and you walk 10 feet, you spin around and you sit down. That's one test. How fast can you sit and stand from a chair in 30 seconds?
Right.
So, by the way, these markers are available for physicians too.
Right.
Anybody can do this test. So you can have a quick little, we know how the encounter session is, you know, short.
Yes.
But
yeah.
very quickly, I think we can help people and
Yeah.
give them the right access and motivation to help them be successful, the tools for success.
Yes. So, I mean, that's kind of the idea of the integrative approach that we're taking. I appreciate that you're right down the road and you're taking a physical aspect to helping these people, because that's tremendously important for just helping people improve their health.
Absolutely.
So how can people get a hold of you if they want to?
Well, they could call me at 619-851-6980. We're at workoutwithkirk.com. I'm all over the internet. Stop by and say hi. We are by appointment only, and I'm pretty busy, but we're always, you want to come in and say hi, shake my hand, that's fine.
You're right down on La Mesa Boulevard.
1,000 yards.
Okay.
In fact, I was at 24 Hour Fitness working out 2 nights ago, and the guy yelled from the pool, "You kept the weight off!" And it's kind of, you know, it's late at night, it's 10, I'm working out, and I'm in the back trying to relax, do a steam and sauna. And I went, he goes, "I'm from LA Fit." "Oh, wow, great, yeah, good for you, thanks."
Nice.
And it's amazing. At least once a week I'll run into somebody who, you know, it's pretty cool. I've kept the weight off now 11 years.
Yeah, you've been doing this a long
And
time.
I've got a lot of stress. But it's planning. Just make your plan and work your plan.
Right.
And then you have a wonderful program here. I have a client here, and it's just getting tremendous results with weight loss.
Yeah, right.
And
Good.
I believe in the team, right? It's a team approach.
It is a team approach.
It's a
That's
team
right.
approach.
Everybody's got to know what's going on.
Right. And I can't be everything to everybody. No one can.
Yeah.
But it's great. I know I can send a patient to you or to Lisa Marie for nutrition, and I'm gonna feel really good about their encounter because I'm a patient here too.
Yeah, we try. I mean, thanks for
You
that
do a great
support.
job.
That's awesome.
Yeah. So I'm excited to be here and that you're so close.
All right. Well, thank you very much.
Thank you for having me.
Yeah, thanks for coming, Kirk.